Did you know that something as small as a number on a machine could decide your future health? Yes. High blood pressure, also known as hypertension, is often called the silent killer, and for a very good reason. You might feel fine, no pain, no symptoms, but beneath the surface, your body could be heading towards serious danger. Why it's dangerous. Unlike a fever or a cough, high blood pressure doesn't always show itself. It quietly damages vital organs like your heart, brain, kidneys, and even your eyes, often without any obvious signs, until something suddenly goes wrong. That's why checking your blood pressure regularly isn't just a good habit, it's a life-saving decision. Let's break down exactly what can happen if you ignore your blood pressure. Heart attack. When your blood pressure stays high, your heart has to work extra hard. Over time, this pressure can cause your arteries to narrow or even block completely. The result? A heart attack, which might strike without warning. You can feel chest pain, lightheadedness, or in some cases, nothing at all until it's too late. Stroke. Your brain depends on steady blood flow, but high BP can either block a vessel or make it burst, both leading to a stroke. This could leave you unable to speak clearly, move one side of your body, or even recognize loved ones. Recovery isn't always guaranteed, and many are left with lasting disabilities. Memory loss and dementia. The brain needs oxygen-rich blood to function. When high BP slows that flow, your ability to focus, remember, and think clearly starts to decline. This brain fog can worsen into full-blown dementia, and yes, it can affect people under 62. Vision loss. Your eyes are home to delicate blood vessels. When pressure rises, those vessels can become damaged, leading to blurry sight, floaters, or total vision loss. This condition is called hypertensive retinopathy, and many don't notice it until the damage is severe. Your kidneys filter waste from your blood, but high blood pressure can scar the tiny vessels that help them do this job. As damage builds up, you may feel more tired, swollen, or unwell, and in extreme cases, you may need dialysis for the rest of your life. Heart failure. Think of your heart like an engine. If it's constantly overworked, it will wear out. High blood pressure forces your heart to pump harder than it should. Over time, this weakens the muscle, leading to heart failure, where even walking upstairs becomes exhausting. Aneurysm. One of the most dangerous effects of uncontrolled BP is the development of an aneurysm. This is a bulge in a weakened blood vessel, and if it bursts, it can cause instant death. Most people never know they have one until it's too late. Increased risk of diabetes. High blood pressure makes it harder for your body to process insulin, increasing your risk of type 2 diabetes. When these two conditions go hand in hand, the damage doubles, especially to your nerves, kidneys, and heart. The good news, it's preventable. Regular BP checks, a healthy lifestyle, and early action can help you stay ahead. Eat well, stay active, reduce salt and stress, and most importantly, don't wait until you feel something is wrong, because by the time you do, it might already be too late. If you found this helpful, give it a thumbs up, share it with someone you care about, and drop a comment below saying, "Health is wealth." Stay healthy, stay informed, stay alive. Eat well, stay active, reduce salt and stress, and most importantly, don't wait until you feel something is wrong, because by the time you do, it might already be too late. If you found this helpful, give it a thumbs up, share it with someone you care about, and drop a comment below saying, "Health is wealth." Stay healthy, stay informed, stay alive.